Hello, my name is Woljuna, and today I'll discuss schizophrenia, its signs, diagnosis, prevention, and the impact on individuals and communities. Schizophrenia is a chronic psychiatric disorder that usually emerges in late teens or early adulthood. It arises from both genetic vulnerability and environmental stressors. Clinically, it progresses through a prodromal phase of subtle changes and acute psychotic episode, and then a residual phase with lingering defects. Symptoms fall into three domains: positive, like hallucinations or delusions; negative, such as emotional flatness or low motivation; and cognitive, impaired memory and attention. Patients may also withdraw socially or display disorganized speech patterns. Non-modifiable risks include genetic inheritance and male sex. Modifiable factors like cannabis use during adolescence, urban living, or childhood trauma also raise risks. Advanced paternal age is linked to slightly higher incidence. Neuroimaging shows reduced gray matter in the prefrontal cortex and hippocampus. Dopamine dysregulation in mesolimbic and mesocortical circuits underlies psychotic and cognitive symptoms. These structural and biochemical changes correlate with the clinical presentation. Diagnosis begins with a detailed history, mapping symptoms onset and triggers, ruling out other conditions, and reviewing past psychiatric episodes, treatments, and any suicidality or aggression. Clinicians also assess substance use, medical and family psychiatric history, and explore personal, social, and developmental contexts to distinguish cultural norms from pathology. A trauma sensitive physical exam notes appearance, vitals, and screens for neurological, metabolic, and dermatological issues, including medication side effects. The mental status exam evaluates behavioral speech, mood, thought, perception, cognition, insight, and judgment, with focused assessment of psychomotor changes and suicide or aggression risk. Diagnosis relies on DSM-5-TR/ICD-10 criteria. Two core symptoms for at least 1 month within a 6-month period, excluding other causes supported by labs, CBC, metabolic panel, thyroid, pregnancy. And imaging EEG, CT/MRI to rule out mimics. Drug screens and infectious tests RPR, HIV are added when indicated. While we can't eliminate genetic risk, early detection during the prodromal phase can delay full onset, reducing adolescent cannabis use and providing family psychoeducation lower morbidity. Schizophrenia is more prevalent in socioeconomically disadvantaged communities. In summary, schizophrenia is a complex interplay of genetic and environmental factors that profoundly affect brain structure and function. Early intervention combined with medical and psychosocial support can improve outcomes. Community education and stigma reduction remain critical.